record? We are recording. Excellent. So welcome everybody to The Next Evolution. This is our first event back following Chicago XR Summit. Well, we did have the social event in July, but then, last month was the first time we've actually ever canceled one of the monthly event series. But that said, we are here tonight to talk about virtual reality and virtual reality and augmented reality and medical technology. For those of you who don't know me, and there's a couple new folks in the room, my name is Matt Wren. I am the founder of VR AR Chicago. Why is that not advancing? It should be advancing. Now I have to go back and do that. Actually, we didn't really skip much, so that's fine. My name is Matt Wren. I'm the founder of VR AR Chicago and The Next Evolution. My passions and expertise span a whole lot of emerging technologies, so if you'd like to know more about me, feel free to come up and talk to me afterwards. That's about as much as I talk about myself. However, this event series, this is the Next Evolution AWE Nite Chicago event series. It is now and always will be 100% free to attend. With that said, it is not free to produce, so we have to always ask for sponsorship. This QR code will take you to a donation page. We would love it if you could sponsor the event series. I'll leave it up for a few more seconds here because I do see people taking out their cameras. And I'll bring it up again towards the end of the event, or actually before we start our panel discussion. And it'll be around later, but again, if anyone wants to donate to support the event series, we would gladly appreciate it. With that said, I am now going to move on. I see one more camera up, two more cameras up. Don't ever want to stop people from doing that. But let's talk about Augmented World Expo. So the Next Evolution is also co-branded. It is AWE Nite Chicago. There are more than 30 AWE Nites that take place all over the world. We would suggest that you save the date for AWE United XR Europe, which is taking place in December in Brussels. And then there's the event taking place in Asia in February in Singapore. You can also check out... sorry, I lost my place here. You can also attend live online courses at AWE Academy and just check out awexr.com for more information. If you'd also like more information, feel free to ask me. We'll be happy to point you to the resources there. With that said, we are beyond grateful for URL Solutions, who has sponsored our entire 2025 event series. We wouldn't be able to do this without them, so thank you to URL Solutions. And we would like to thank our venue sponsor, 2112. Since Scott was supposed to be here tonight to actually introduce 2112, but at the last minute he had to go to another event downtown. But 2112 is the space that you guys in the physical room are sitting in right now. It is Chicago's creative industries incubator. Again, I'm happy to answer any questions I can about it later on in the evening. VR AR Chicago has our offices in this building. We're obviously hosting these events here as well. It's a great space. And with that said, I am now going to hand it over to Caroline Dennis to introduce herself.
Good evening, everybody. My name is Caroline Dennis. I am really interested in the intersection of virtual reality, augmented reality, all of the immersive technologies, and Web3. And I really have a passion for data sovereignty, for dignity-preserving technologies, and especially in the health equity arena. And I'm just interested in working with global communities and being able to capitalize on the power and fusion of people and technology. I'm also a member of XR Women, which is a global community I'll mention in a minute, and also part of a IEEE group called Symphony, which is looking at the inclusive, sustainable, smart cities and how those are designed with technology in mind. So thanks so much. I do want to say a few words about XR Women. So XR Women is a group of over 1,200 women from over 60 countries. They are really about empowering and advancing the innovation and collaboration in immersive tech. They have a number of events each week in several immersive technology spaces, including Frame. We have a Frame museum here. And they're really just interested, so for anyone out there who might be interested in XR Women, we welcome folks every week on Wednesdays. And in terms of where we sit right now, we're in a platform called Frame, an environment, and that means it can be accessed from your phone, from your computer, from pretty much everywhere because it is web-based. And it will allow you to be able to walk around, to share, to chat. It's pretty powerful given the fact that there is no app that you have to download. So that's where we are today, having this cool, awesome hybrid event along with our folks in person in Chicago. So with that, I'll turn it back over to you, Matt.
Thank you, Caroline. And I also want to bring up our community partners who have helped us with the event. A lot of you were checked in by Ron over there with Envision. Patrick will be giving a demo from Patched Reality. 1871 has been a partner of this event series going on 6 years now, and as well as 2degrees.io, as well as Caroline. We also want to absolutely thank our beverage sponsors, Revolution Brewing and System Seltzer. I will say pay attention to the System Seltzers because they have varying levels of alcohol from 0 to 8%, so make sure you're looking at the can because you want to know what you're drinking. With that said, I did want to add a note before we get to the introduction of talking about medical technology, because there's an opportunity for folks who are actually working with virtual reality and medical technology. Virtual Wear is currently doing a multi-city live demonstration, essentially a giant project that is involving a bunch of universities, a bunch of cities, a bunch of government entities, including the U.S. government. We're part of it as well. They are looking for companies that want to demonstrate medical use cases in virtual reality. If you are interested in doing that, please reach out to me and let me know afterwards, and I will connect you with the folks there, because this is a current ongoing project that actually I believe they're expecting to start this project in the middle of September, and they're looking for a medical use case. But with that said, let's talk about the topic of immersive technology and healthcare, because immersive technologies, frankly, they're transforming healthcare from how doctors train to how patients receive care. Virtual and augmented reality are making it possible to practice complex surgeries in safe, simulated environments, personalize treatment plans, and even ease patient pain through calming virtual experiences. These tools are not just about innovation, they're all about improving accuracy, accessibility, and outcomes. And as they continue to integrate with AI and telehealth, immersive technologies are shaping a more connected and human-centered healthcare system. Tonight, our panel is going to explore where these advancements are headed, where they are today, the challenges they raise, and the opportunities that they create for the future of medicine. With that said, I'm going to hand it over to Caroline to introduce our first panelist.
Fabulous. Thanks so much, Matt. Well, we're really excited to have Hector Mondragon, and he is the CEO and founder of Simtrix, where he leads the development of immersive medical simulations powered by mixed reality and AI. His work focuses on advancing healthcare education by making high-quality simulation accessible to medical students and professionals globally. So thanks so much for joining us, Hector, tonight. Take it away.
Thanks, Caroline, for the intro, and thanks VRAR Chicago also for the event. It's a great opportunity to talk with the whole VR scene and any new person that's interested in VR. So a little bit about what we're doing at Simtrix, right? Yes.
Sorry, can I interrupt you for 1 second, Hector?
Yeah.
Why don't you come on up to the stage and you can stand right over here, and I'll go
that's
stand
right.
in the
Let me go out to the stage.
There you go. Awesome. Thank you. And like I said, you can always flip your head or your mouse over if that's easiest. So
Okay.
You can go ahead and look at the slides. Thanks.
Perfect. So in Simtrix, right? So we've been building Simtrix the past year and a half. We really saw the opportunity with the mixed reality headsets and the advent of current day AI to really challenge the way that healthcare simulations were being built and developed and in the space. So really our goal here was to make the most immersive healthcare simulation in the most accessible headset that you could get, right? No more high-end PCs to try to do VR patient simulation. Right now, we're using the Quest 3s to have the most accessible simulation that you can get in healthcare, right? And a little bit about our features, right? In the next slide, I think there you go. So again, what makes our technology so immersive? It's the mix of the following technology. So first off, we're using mixed reality, which really makes the most accessible experience, right? A lot of people, they used to be maybe nauseous in VR. Usually that doesn't happen to the hardcore users, like a lot of people here in the meeting, right? But doctors, nurses that have never used VR, mixed reality really does a lot for them to be eased into the VR space. Also, our hand tracking technology with physics allows you to touch any part of the patient, and the patient will react to you pushing or pulling their body, which makes it so much more immersive, and makes it a possibility for you to do a lot of physical exams without needing gloves. And then with AI, you can really do a back and forth interaction with patients, which adds so much to you to understand their diagnosis. And finally, the MR multiplayer really does bring people together in our simulation. So that's what we built with Simtrix, and that's why also I would love for you guys to demo it later, so you can also give me your feedback about our technology. Yeah. So yeah, I'll be really happy to talk a bit more about the medical space in VR. There's a video. I'm not sure if it will play in frame.
Yeah,
It should. It did.
Did you want me to roll the video?
Yeah, sure.
I'm feeling a bit worse today.
All this first-person view.
How come? What's happening?
I'm going to listen to your heart.
All right, please go ahead. I'm ready.
You can see here the physical and
Hi, how are you feeling?
I'm feeling pretty anxious due to the chest pain and shortness of breath.
So does it hurt here?
Yes, it hurts in my chest, especially when I breathe deeply.
The vitals also change real time depending on your actions.
Breathe deep.
Okay. Yeah, and well, there are some key takeaways about our work in Simtrix, but kind of like what I was mentioning, right? To us, accessibility was number one. As you saw, all the technology that you saw in the video and you can try is working on the most accessible headset on the market, the Quest 3S. I think it's only $300 retail value. So it makes it so much easier to get to access, and mixed reality really does a lot for user experience. Also, asynchronous doesn't mean that means that you don't need a teacher on the other side to guide you through a simulation. It's all through the AI. You can do the back and forth, all of it through the comfort of your own home or in whatever space you can be, right? And also, to us, multiplayer was a big focus from day one. Doing multiplayer mixed reality is a challenge, but to anyone that's experimenting right now, we use spatial anchors for that. You can check that out in the SDK of Meta. Pico also has that. That is a way of locating different users inside a mixed reality space. And all of this really is for our goal, which is to democratize simulations. That's why some of our clients are in the U.S., but in something that we really push for, a lot of our clients are also in Latin America. Latin America, a lot of those universities don't even have the funds for a big mannequin deployment, right? Those cost a lot of money. But with XR, now you can have a lot of students that wouldn't have access to simulation otherwise to now do it in a very, very immersive way in their simulation lab in their universities. So that's more or less our goal in Simtrix, and that's how we were achieving it through the power of XR, AI, and the technology that is available to us. Right.
Thank you so much. I appreciate that. Thank you so much. So
Thank you, Caroline.
I wanted to ask, let me just come right up onto the stage here. I wanted to ask for those folks, because, you know, people talk about mixed reality. I think it's important, especially since we're talking about a healthcare audience, that can you describe what mixed reality means? I mean, I've worked with it, but I think it's helpful to kind of describe the difference between, let's say, working with some sort of platform that is not mixed reality versus mixed reality. And then the other part is the collaboration part, because I find that really interesting that you don't need to have a teacher or professor to do this. So would you just address those two, just kind of unpack those a little bit?
Yeah, I think all that goes back to our guiding word, which was options. We always want to give our clients options. So mixed reality works great if you have a professor, a teacher right by your side, because not only will you hear him as you would do in VR, but now you can see him because it's mixed reality, right? You have the camera pass through. So you can have your teacher being right next to the patient, and he will guide you, explain to you, talk to you while you're doing the actual work. But if you don't have the professor or the teacher right there, and our client actually wants to use Simtrix for, let's say, the students use it in their own spare time, that also works perfectly too, because the AI guides you through the conversation. You don't need anyone standing next to you. You can do that back and forth without anyone clicking on the answers of the patient on the other side, which is how healthcare simulations have been working for quite some time before AI. So it's all about options.
Right. And I imagine that once AI becomes more integrated in these platforms, that there'll be also great ways to save sessions and to save work, just like you would with studying, which to me would be amazing, right? To save those instances, so then you can go back and refer if you're studying for, you know, the MCATs, or you're studying for the bar, whatever other, you know, testing that you're doing. That's pretty valuable. You mentioned too that, and I have come across many Latin American founders, and I find that in Latin America there's a big openness to technology. Can you speak a little bit more to what you're seeing in those countries in terms of adoption? Do you think that they are more advanced in terms of their readiness, or just because they're driven by the sheer savings of education in this way?
Yeah, that's a great deal. You know, Latin America is its own beast. As in, there are a lot of countries in Latin America. You will see that some universities, obviously, they don't even think about deploying this, right? But in every country, you have a couple of leading universities. They always fashion themselves after, you know, being very technology driven, very innovation driven, but to a point in which they might not know what are the metrics, how to deploy it, and they just want it, and they need it, and they want to deploy it, and they will deploy it faster than any other American university. Now that comes to a fault also, because if you don't have the correct vendor, you know, the correct company guiding you, then the project might not end up that good, and might end up poisoning the well of certain countries' XR ecosystem. So they go sometimes too fast to a fault. Something that we've seen in our years of experience is that obviously Latin America is great for those innovators, but we also have to sometimes reel the scale in of the project. And to not have obviously any problems during the way, and have a successful project. Once you have one successful project, one of those countries, then it will become a huge use case, and it will drive the adoption of the rest of the universities. So yeah.
Right. That's great. Well, we'll have some time at the end too, Hector. So thank you very much. I know we'll get into some questions from the audience a little bit later.
Perfect.
So I'll turn this back over to Matt.
All right, thank you, Hector. Give me a sec. Let me advance some slides here. And Ryan, you want to come up and grab the microphone? Ryan Markey is a third-generation optical professional with over 4 decades of experience spanning lens manufacturing, retail, and global trade. As co-founder of Optical Near Me, he combines deep industry expertise with innovative digital solutions, helping both consumers and optical professionals navigate the future of eyewear. All you.
Thank you. Yes, I've been in the optical business all of my life. I'm third generation. Learned a lot from my grandfather and my father. But when I was 12, I started building my own computers. Everybody thought I was nuts, but because I'm old. Okay. Anyway, my love for computers and my love for the optical industry and my love for helping people is really what got me into working with this kind of technology. And I went to work for a company, and they started working with Google Glass and the Epson Muvario, BT300, and things like that. So I started to design lenses that were special for that, and I started to work on different use cases. I ran into my co-founder partner, and we started talking about Optical Near Me and how our industry was changing. The optical industry is one of those things that is a lot of people look at it like fashion, or it's a dress item that helps them see. They forget that it's actually a medical device until they go to buy one, and then the insurance company, the doctor's office goes, "So what insurance do you have?" And they just sell you the one pair of glasses that'll cover something. What we wanted to do is we wanted to give the patient knowledge and guidance and give them the ability to have all the information they needed to make an educated decision. Well, the technology wasn't all necessarily there yet. The beginnings were, and we started to build something that was multi-sensory and patient-based. And we built ourselves, So we started taking that technology and building ourselves something that we could give the patient so that they would have the power to make decisions on their own. Some of our stumbling blocks in the very beginning were that we did what a lot of people do, and we assumed what they would want. And we built a few things like that. They were being used, but there were other things that were needed. And so as AI got smarter and as we began to see some of their challenge, we started developing things. You've seen the virtual try-on maybe with some of the other folks that are out there making glasses, where you can try on the glasses, your face shows up, the glasses pop on there. Problem was you couldn't turn your face. We actually take quite a few photos of your face and do a 3D rendering of your face, and we know the size of the frame, so we make sure that it actually fits. It's not resized to fit your face. That was one of the problems we originally ran into that we cured. If you turn your face a certain way, sometimes the glasses would be askewed. We fixed that as well. So patient demand or patient need made us develop new things. Another thing that we did is we created a person in the video that we get to, not yet. You'll see that we've also developed an AI optician. And I say that, I shouldn't say that actually, I should correct myself. The AI assistant that's in there is more a guide. Opticians and the knowledge that opticians have are required for getting a good pair of glasses. They're not just somebody that's in there to take your order. So we have imbued Professor Glassman, that you'll see in a bit, with a bunch of that knowledge, but also face shape, colors, things like that, so that you can enjoy your glasses, what your special uses are for eyewear, so that we make sure we get you the right lenses. those are the kind of things that we built into this model. And then we also are using that same AI to make sure that you can ask questions, and that AI has a very deep knowledge base when it comes to optical. So you can ask those questions, and the AI will respond to you. We constantly train our AI and look at things that it can't answer so that we can give it additional knowledge. Fortunately, I've been doing this for a decade or 6, so I get a chance to, I have that knowledge, or at least I have the contacts to get that knowledge. We have built a store that I'm going to show you guys here in a minute. It has the ability for you to actually go into a 3D world, walk through the store. Your camera can go live at some point, and it can take a picture of your face, do that rendering. You can try on glasses in the store. You can shop. You can upload your prescription. We get your permission for a selfie, so that if we need to re-verify measuring in sizes, we can do that as well. It's a medical device. We want to make sure that you have what you want. We also did a couple of other things that are kind of cool. We have started to work with celebrities who are into the wellness space. Because our partner company has its 3D world, and they are tied together with Fortnite, we built a Fortnite game for this celebrity. We also built special eyewear that had special lens technology for adjustment of mood, and one of them has the ability to reduce ocular migraines. Through studies, they say this. I didn't know that. I actually had to read the studies, but they're real. But we are always constantly going out and trying to find things that are collaborative. So we are finding that optical fits in many other things. We have developed a audio frame product that has a speaker and a microphone, and we have designed software for different use cases that's AI, that you'll see people eventually walking around with our glasses talking to themselves, but it's AI that's in their glasses that they can talk to, and it's not quite like Siri because it's specialized to them and to what their interests are. We will be coming out with a camera and audio probably by the end of the year or the beginning of next, so that not only will the AI that you get in the Ozone software, it's the brand, if you get the Ozone software, you will be able to, they will be able to see what you see, and you'll be able to have a conversation about what you're seeing and what's going on. We talked to one company about, one chef, and the chef is actually has downloaded all of his recipes into this software, and you'll be able to, with the ones that have the video and the audio, they'll help you shop for the groceries. They'll help you stay on a particular diet if that's what you're looking to do. There's all sorts of fun stuff that we're doing with glasses. Again, it's still medical. It's still what you need to see. But because it is on your face and it's seen so much, people look at it as fashion and don't look at it as utilitarian. The other thing that we're doing is we're working with esports. We have specialty dyes and lens designs that we're doing, and we're going to tie in the AI with all of that. We have wetting solutions for their eyes so that they can make sure that they are that they keep their eyes hydrated and work on their health. So we're not just doing the AI. We're not just doing the mixed reality, we are also tying in the medical issues and solutions in our process. Because of one more thing, because I've been doing this for so long, and we have a way to streamline the process. We also are trying to make sure that the consumer gets value with this. So not just education, not just on-demand, AI to sit there and give them the information they want, not just a place to contact an optician and talk to them. When in some states they require you talk to an optician. So when you go into the store, we actually have a way for you to hook up to an optician and talk to them as well. So all that mixed together is giving a much better, much broader experience for someone. So let's go ahead and we'll go to this.
Greetings. I am Professor Seymour Glassman, and it is a distinct pleasure to welcome you to Omniverse City. Excellent. I would be absolutely delighted to guide you through the wonders of Omniverse City. Let us begin our journey, and I shall lead the way, revealing some of the extraordinary sights and experiences this world has to offer.
Actually, we're typing right now, but you can talk to it.
Splendid. Our first stop brings us to the fascinating world of Drika Rosé Eyewear. These aren't just any glasses. They are a fusion of fashion and wellness, designed to truly enhance your perception and comfort. Please, follow me closely. Ah, an excellent question. Right this way, to the Order Drika Rosé Eyewear kiosk. Here, you can explore the collection and even place an order directly. It's truly a seamless experience, allowing you to bring these innovative designs into your life with ease. Ah, an excellent choice. The virtual try-on is one of my favorite features. It truly brings the eyewear experience to life.
So I have some QR codes if you want to play with any of this stuff on your phone, if you want to do the virtual try-on. We also have a virtual assistant that you can take your picture and it'll take your face shape and it'll tell you what shapes are best for you. You can put in your fashion colors. You can put in what your main use, what your activities are during the day, and it will suggest the lens designs that you should have. And it'll also take the measurements for the distance between your pupils, which the reason this was originally delayed was because I'm a stickler for accuracy, and it had to be right. So other people, yes, have launched this, but it's not as accurate as ours. I shouldn't say that, should I? That's mean. Anyway, I also have, so I've got the virtual assistant, the VTO, and there's one other thing that I have on there that you'll be able to play with if you want. So does anybody have any questions?
We'll get to questions from the audience towards the end. Stay up there. Don't go anywhere yet. You guys stay there. Because the first question I got to ask is, as an optical professional, as somebody who frankly straps computers to my head all the time and looks at all sorts of virtual reality and augmented reality devices, what would you say is the opinion of opticians terms of actually using this technology and using virtual reality, having the screens that close to your eyes, using augmented reality. Can you lower that real quick? So it's just feeding back off of these. But yeah, so the question is, what do opticians think of the technology and people using it, prolonged use, I'll say?
Well, actually, the doctors that we are working with are dry eye specialists. And they really don't like the fact that you're not blinking as much as you should. When you're sitting in front of a computer, you're blinking like 20% as often as you should. You're blocking the oil glands in your eyes, and dry eyes is a real thing. I mean, it's very uncomfortable. It's scratchy. You end up with gunk in your eyes. They've actually developed things to make it better. So if you're into esports or you're in front of eyewear all the time, we actually have a whole regimen. And in our metaverse, or in the optical metaverse, there are places these doctors have actually put in that'll actually train you and show you what to do in order to have better eye health, pre and post extended use.
Well, I'll admit to everyone, I do actually have from my eye doctor an entire regimen of stuff that I have to do every single day, including heating up my eyes, because I've blocked all my pores from spending too much time staring at computers than in virtual reality.
That is a real thing.
Yes, it is. All of that said, next question for you would be just sort of getting away from talking about using the technology to support consumers. How are opticians considering using augmented reality and virtual reality themselves for like training or to help their practices or to help with, I guess, the manufacturing process? What are the other ways that you could see opticians using the technology?
Well, one of the things that we're working on right now is a tycoon game, tycoon style game, tycoon style game, where an optician can actually go through the process of selling someone and or making glasses and answering the questions the right way. In one of the manufacturing facilities that we're working with right now, we're working on how to use the equipment they have in the process and how to check for quality. Because probably the biggest problem when you're making glasses is the lenses get scratched during the process. Well, some scratches you guys would never see, but because we look at eyewear all day long, we'll see this tiny little hair scratch that's way up, and there's nothing wrong. And it's within standards. So being able to show them how to get through the process and do some role playing.
All right, last quick question for you is just looking ahead, do you see smart glasses becoming like an everyday, everyone's wearing them kind of thing? Do you see this actually happening, or do you think that that's more kind of a pipe dream to some of the technology companies? Or, more to the point, if that is going to happen, what do you think has to happen for us to get there?
Well, I intimated, but I think it's super important. I think that the use cases have to be tailored to what the consumer's desires are and what they're going to use it for. You and I think had a quick conversation about this. Yes, it is required in your workplace as well. I think that is important. So basically, workplace technology and adoption is important, but I also think that when it's developed, it has to be that way. In one of the things that we're doing at Optical Near Me is we're actually developing through the Ozone software. We're doing that, but with the Osware, which is both the lens technologies, which is Pixelware, and the frame technologies, which is Osware, what we're doing is we're making products that are not only useful and do the things that you want them to do, but also are comfortable, adjustable. You can put your prescription lenses in it, and it lasts you more than 3 hours, which was the problem with Google, and they overheated. Man, that was hot. Stuff got hot. But it's got to have a real use.
Excellent. All right, so you can go ahead and turn on the microphone off, put it back down. We'll have you back up when we get to the audience Q&A at the end. But before we get to thank you again for presenting. Before we get to the full Q&A, though, I'm going to hand it back over to Caroline to introduce, there we go, Robert Fine.
Excellent. Thanks so much, Matt.
Hold on 1 second, please, Caroline. What's up, Tom?
Sure.
Holding for Tom. Technical difficulty. It's okay. It happens. All right, go ahead, Caroline. Thank you for the hold.
Of course. All right, Matt. Well, next up, I'm excited to be talking with Robert Fine. Bob. We'll say Bob because that's how you go, right, Bob?
I go by Bob. I do not go by Rob or Robbie.
Okay, I got it.
Or Bobby. So.
All right, and I do hear your audio here. And Matt, I just want to check in with you. If he were maybe to speak up a little bit, would that be right for you? Do you think? Because I don't know how people hear in the stream.
Yeah, Bob, do you have the megaphone on?
I do now. I do now.
Awesome. Yep.
Okay.
Excellent. Excellent. So, Bob is the executive director and founder of an organization called the International Virtual Reality and Healthcare Association. Easier to say is IVRA. And I found out today, it's a global-driven organization advancing the use of immersive technology in healthcare, much needed. With a background in spanning in IT leadership, engineering, and education, he's grown IVRA from 40 founding members in 2019 to over 130 organizations worldwide, while also teaching XR at Champlain College and leading international symposia on VR and healthcare. So I'm really happy to have you with us tonight, Bob, and this will be a great opportunity to figure out how they can be a part of this really cool community called IVRA. So take it away.
Yeah, thanks. I'm just going to take a couple minutes and provide a little background on myself. And Caroline, you did a great job of getting some of that done for me. So thank you. I spent first half of my career as a systems and sales engineer and learned RF engineering on the job. I graduated with a degree in mechanical engineering. So worked in cellular quite a bit and did a lot of network planning. And most of my work since graduating college has been overseas in one form or another. I've worked at both large organizations, Caroline, more than 1,500 employees, and some very small organizations, startups in the 50 to 100 employees realm, and smaller than that. I had a dream job for 10 years from 2000 to 2009, and was hired as global director of IT for a large conservation nonprofit based here out of Washington, whose roots are in the Nature Conservancy. And I got to build out their global network in 40 countries. Did that over about a 7-8 year period and build an international team of 25. Enough travel for a few lifetimes. Next slide, please. In 2009, so I suffered my first layoff ever the day after my 38th birthday at the height of the financial downturn, which affected everybody. Oh, also I did forget to at the beginning. I wanted to thank Patrick O'Shaughnessy from Past Reality. I think I saw him in the audience for recommending me to Tom and Matt for the event tonight. So thanks, Patrick. In 2009, I ended up a little bit by happenstance organizing what was the first conference about social media on the East Coast here in Washington. Got a lot of national press coverage and attention. PBS NewsHour filmed a 20-minute piece that aired that summer. And I didn't know what I wanted to do after the conservation work. I ended up doing 20 conferences by myself across the US and Canada. I was going through airports with 4 laptops and 2 projectors. And then in 2010, I had a book come out called about applied social media there in the lower left. Much to my surprise, got picked up as a textbook at about 10 universities. And still looking for a niche in this space. And this is, the days of Mashable and Daily Beast, those things, Vice, early days of Vice. But no one had done a print magazine about social media, besides the obvious reasons of the slow death of print. But I was a big fan of print still, and my sister's wife's husband's cousin, if you can follow that, who's graphic designer. We put an issue together over a weekend and launched it at an internet conference at Javits Center, New York, in May of 2011. And 3 weeks later, I had national distribution with Barnes & Noble. And so bootstrapped this on credit cards out of my apartment. But within a couple months, we were distributed in 20 countries and we're across chapters in Canada and Fry's on the West Coast. And we were named one of the 15 highest magazine launches of 2011 and got some good notoriety and acclaim. Only time I ever raised any angel money, it was a very small amount from the former CEO of Time Inc. Short version of that story is it was a 2-month marriage and a 3-year divorce. But we put out 17 print issues over 3 years. You can still find copies resold on eBay, and still really proud of it. It was an expensive creative outlet, but loved every minute of it. Next slide. So I had a couple lean years in between, but I'm a longtime video gamer. Started with the Atari 2600 and have been through every system since. Always kept an eye on VR. Shortly after the Oculus Kickstarter, and then they got bought by Facebook. I started experimenting, and I think I did some of the early events that took place around VR. Actually, we did an event in Chicago in 2016. I can't remember the name of the conference center, but not too far from the merchandise mart, which is I think where you guys are located right now. But experimented and was just trying to see where the interest was in VR. So VR in higher ed, VR in architecture, VR in defense. We did our first VR healthcare event 9 years ago here in Washington at George Washington University Hospital. That was a good success compared to the others, and some of you may know Walter Greenleaf, who's been in the healthcare VR space for 30 years, and with his help, we put on a follow-up event at Harvard Medical School in March 2018, in between 2 nor'easters. But we had 250 people, and it felt like a moment in the space, even though this was still very new to me, especially in healthcare. So next slide. So I decided to just focus on healthcare in VR and started this association formally in March 2019 at our 3rd annual conference. We launched it with 40 founding members. HP was an anchor of that. Working with them was great. I was really sad to see them get out of the market. We'll see if they come back into it at some point. And today we're about 130 members, give or take, and about 40% are outside the United States. And been great working with Hector, who is working both between the U.S. and Peru. Next slide. And so, my focus for the last few years and still moving forward is really just educating the market, educating physicians, nurses, practitioners, anyone we can get in front of. It's just a very slow process. I have not yet found a better method to convince people about VR and its power within healthcare beyond putting them in a headset. But how do you do that cost effectively and in a timely manner when healthcare is 20% of the U.S. economy? It's a slow process, one person at a time. But once you've convinced somebody, then they can usually run for themselves. But getting people to try it for the first time can be difficult. Next slide. We had a book come out. This was a 2-year project back in 21, hard copy. We went through 2 print runs of 5,000 copies. I was very lucky to get Palmer Luckey to do the forward for us. I really need to get this into a PDF and out there. I never got around to doing the Kindle version, unfortunately, but I will. You can find, well, you'll find some copies on Amazon, probably a couple on eBay as well. Next slide. Right now, we're planning our 7th annual conference in Europe, which is going to be in Iceland this November. A lot of excitement about it. Looking forward to it. Next slide. And I can't believe planning our 10th global symposium will be in Tampa Bay at Moffitt Cancer Center in early next year. And I think that's it. Next one. Oh, sorry. Also, I'm back in 2017. I started an event called Virtual Reality Day. It was day focused on public education. Back in 2017, the idea was, hey, let's hold it right around Thanksgiving during Black Friday time. Try and get people excited to buy headsets. This is back in 2017, 2018 time. It really blew up. We went from 7 cities to 76 participating. Maintained some good growth in 2019 and had a very large event in alt space for a couple of years. And then, unfortunately, the pandemic hit, and we went to online for a couple of years, trying to get it back to in person. I think we're at a point where we could benefit again from Virtual Reality Day. So working to get that organized for this year. Next slide. And my contact information, very easy to get a hold of. And that's about it for me.
Thanks so much, Bob. Appreciate it. And there'll be opportunity to ask some questions from the audience. But I did want to take on we had just talked about it briefly earlier, and that is, what do you think are some of the, obviously, we talked about the fact that I now work for a health plan, a small health plan, and what are some of the barriers, or at least some of the considerations in terms of health plans, hospitals, clinics, from adopting or doing pilots? What are you seeing in terms of the environment? And then maybe what are some of the ways that you have seen companies be able to overcome that in certain ways?
Wow, tough questions. You don't make it easy. It's, I can't think of a much more difficult sector to try to work within than healthcare. It's not straightforward at all. And a lot of that, goes to how healthcare is funded in this country, particularly. Right. You have both private, public, quasi. So much is government funded. Insurance makes it all very, very complicated.
Right.
And actually, I was just doing a presentation for my class earlier today about it's kind of intro to VR in healthcare. And one of the things that there's a high bar you have to meet because it's not enough. Well, a novelty is not going to last for very long anywhere, but right. Oftentimes, sometimes, and I think Hector kind of alluded this to before, people just want it, and they'll try it and because it's cool and it's great, and then it'll sit on a shelf. But for it to be adopted and taken seriously, it's got to meet a couple of high. It's got to be. It can't cost any more, and preferably cost less than the current solution. It can't add to the existing workflow. So if it's going to add time and headache to a nurse or a practitioner to use the headset, even though it may provide a lot of value, if it's adding minutes and headache to their day, they're not going to want to use it. Right. And it's got to have the efficacy behind it as well. It's got to prove its value and that it has it can do better and provide better care and value than the current regime or current system. The thing is, though, when we think about things like that, I mean, one of the most valuable things that VR can bring to healthcare is education, and it's not just at the nursing or med student level, but ongoing professional education. Right. And there's so much opportunity to, no one wants to go to the hospital, especially when I can't remember the statistic, for sure, but something like 1 out of every, 4, issues that happen to you health-wise is due to medical error. Just as many things happen to you while in the hospital than what you originally went in for. And a lot of medical errors can be prevented. They're human caused, and a lot of that comes down to education. Anyway, that's maybe a short version of trying to answer some of the barriers. I think from a success standpoint, it's about finding the right champions. Honestly, it really also. I think for healthcare to succeed, it needs leadership and senior buy-in. Leadership wants to see technology applied and used. Rarely, I won't say never, but sometimes a grassroots approach will work, but then it takes a lot of work and effort by a couple individuals that might be on top of their normal job trying to get interest. But we're seeing, there's plenty of good studies that demonstrate the value and the impact that it can have, both in variety of, whether it's for the patient, for in-operative surgical use, or in hospital, or for creating better physicians and nurses through training. But it's just there's friction with it. It's not easy to adopt. We're, as an industry, Pico, Meta, HTC don't make it super easy to adopt, and Meta, being the large market player, hasn't made it easy. But the data is there, the proof is there, and it's a cultural problem too. It is. If you're a doctor that's been teaching anatomy for a certain way for 20, 25 years, it's going to be hard to be convinced that you should use VR and teach in a different manner.
Right. Yeah, and I think there was. I think that you're right, and at the same time, I always think, I wonder if there was a value for insurance companies, if they realized that this had this value and that actually could end up saving money for all kinds of things in healthcare, to be able to find that value. And that's not easy to do. But that, to me, because they end up driving so much of what happens in healthcare, unfortunately. And that's not for the better, that's oftentimes. But I'd like to take that conversation a little bit further after we have the audience Q&A, because I do think that we've had some incredible, as we have right here, we have incredible founders, incredible ideas that are actually working today, and they are functional and they're amazing. But I just think that there's a lot more. I want to hear what the audience thinks about this and what their questions are. And I think also it's community. And that's why we're here. And that's why Matt and Tom and all of us at VRA or Chicago are here, because it has to have villages and communities behind it. And like IVRA, like XR Women, like all of them. But let's put a pin in that. I'm going to turn this back over to Matt. Matt, thanks so much. Thanks, Bob.
Thank you. So what we're going to do now, I'll let that go. So we're going to have all of our presenters, those of you who are in the virtual space, get back yourselves up on camera and on stage. Ryan, come on up here, grab your microphone. Ron, can I ask you to do Q&A microphone again? That's over by Tom at the moment. So while we're getting that set up, one of the things, again, I have to do this, sorry. Nobody likes doing this. Let's be clear. Nobody likes asking for money, ever. But again, we run a not-for-profit. This is what we have to do. So the main thing that we will ask, just a couple questions for you guys who are here, and for those of you who watch this video in the future. If you learned something new, if you made a business connection here, if you saw a cool demonstration or a technology that you want to check out further, donating is how we keep this alive. And we're at the point where we really do need to actually bringing in money to continue doing this. So with that said, there's a lot of work that goes into this. There's all sorts of stuff that we can do to help support. I'm going to put this link up for one more second so that anybody who does want to get out a camera or shoot the video later can check the QR code. And with that said, great, we're going to get back to the discussion. So you can sit. That's why we have this whole couch up here just for you. There we go. Okay, so the way that Q&A works, for those of you who are paying attention, I guess we don't have to worry about the live stream this time, so that's nice. But if you have a question here in the physical space, raise your hand. Ron will get to you with the microphone. He'll hand you the microphone, ask your question, hand it back to Ron. In the virtual space, for anyone who has a question, just raise your hand, use the raise hand feature. Caroline will indicate to me that there's a question in the virtual space. I'll toss it over to her. Again, unmute yourself in the virtual space, ask your question. And then you can direct it at any one of the folks who have presented. For those of you who are presenters, feel free to actually make this a discussion. That's actually where a lot of the value comes out of this, is you guys sort of talking to each other a little bit and learning from each other. Because I don't know if, I'm guessing that Hector and Bob have met before.
They know
but
each
I
other
don't know
quite
if
well.
either of you have met Ryan. So with that said, who wants to ask the first question? I'm watching for a hand. Okay, I got two in the physical space. Go ahead, take your pick. All right, we're going to the back of the room.
Hi, thanks. Can I ask a question from each one of the three? Sure. All right, great. So I'll start with Ryan, since he's
I'm here.
Thank you. Good to hear and learn about what you're doing. As you know, the health insurance industry segments the optical world and the dental world in an entirely different segment and liability. So in every aspect, it's segmented slightly differently than health insurance, including coverage, the kinds of services it offers. How do you foresee, having been in this industry, in the optical industry, you said for 60 years, how do you foresee any change coming for the masses in terms of coverage in that sector?
Thank you. It's a great question. And I've thought about this quite a bit because my main focus for wanting to do all of this is because I want to make sure that patients get what they need. And part of that is that the device itself, when I started in the industry, over a very large portion, 70 some odd percent of the people who bought eyewear just paid for them. There was no vision insurance. And they were just fine. Eyewear doesn't necessarily have to be quite as expensive as it is. And there are reasons that doctors do this, not just in vision care, but doctors in general will have their standard prices a little higher, and that way their normal and customary fees are covered by insurance at a discount. They negotiate it down. Same thing happens in vision care. What I would really love to see, and then this is more of a personal thing, you said, how do I see it happening? I'll get to that real quick in a minute. What I'd love to see is people to be able to afford to get their own eyewear at a reasonable price, and that the medical maladies were covered by health insurance. There is a huge difference between those two things. One is a prosthetic device. Eyewear is a prosthetic. How do I see it happening? Vision insurances have gone to two main insurances, VSP and wow, I'm getting old. Huh? No, there's the one that's owned by Eslo Exotica. IMED, thank you. IMED and VSP are the two largest folks out there. And they are doing something similar to either a discount plan, or they are consuming large companies and saying you have to buy their stuff. So without reducing choice and with getting patients more than just that one pair and getting them things that will give them good quality of life, good care, um, those aren't necessarily always covered.
So before we continue, I will ask that questions be asked quickly, and same thing with answers. So we'll try and keep them to a couple minutes so we can get the discussion moving.
Sorry.
That's all right. Thanks.
My second question was for Mr. Bob Fine. Great work that you've been doing by yourself, quite a pioneer. You called your company International Healthcare Association with the VR in the middle, which I found very interesting. You've noticed most healthcare associations, the way they have a huge lobby, and they do have the ability, I hate to say it this way, to twist the arm of a lot of providers to join them. With not being able to do that and being more of a, for the good association and for educational purposes association, what struggles do you see in adoption other than what you mentioned, grassroots level? How do you expect healthcare to impact you in the next 5 years with adoption?
Yeah, I don't know, to be honest. I mean, we're now for 10 years. I've had a slide that I've shared with startups in the community that VR in healthcare is a 20-year journey, and I think people didn't really take that too seriously, and I even said it at times a little bit tongue-in-cheek, but we're kind of now 10 years into this time of the 20-year journey. There's a couple things. One is you had mentioned briefly something about
I hear that. Hang on a second. We lost audio for a second. Hold on. Bob, hold on one second. We lost your audio. Check. You should be able to hear me.
Fine. Keeping it active.
All right. Well. Okay. Sorry. Please continue, Bob.
Okay. Not sure where I got cut off, but talking about the lobbying side, we have XRA Association based here in DC. They're focused just on U.S. policy, but they have to also support all industries. So healthcare is just a piece of it for them, and they can only put so much time into it. One of my goals this year, next year, no matter your politics, for good or for bad, and where you sit on it, but the reality is we have to kind of deal with the current administration. If we can get virtual reality in front of HHS, in front of CMS, and make them understand the impact that it can have, change can happen at much more rapidly when it's directed from the top down. And CMS just had a meeting at the White House not too long ago that was technology focused. They had tech companies invited there. It was more, I think, from a focus of streamlining their database and infrastructure systems. But it's a shame that VR or even AI glasses were not necessarily part of that discussion. Did I answer all of your question? I feel like there was something I missed.
I think you got it, Bob. So we're gonna go ahead and go to Charlie's question.
Okay, you can hear me? Okay, great. I had a couple of questions, but I think this last set answered a bunch of them. Could you guys talk about elder care? Things like training for CNAs. I mean, there's this huge growing population of older Americans and across the world. And I see VR making some inroads in some places, but I don't hear about it in terms of training, like on the ground for somebody as simple as a CNA who spends most of their time with the residents. Do you know of anything where that's happening?
Yeah, I think senior care is one of the greatest opportunities for VR, AR. And we've had a number of members and a number of companies that have had some success in the senior care market with assisted living. I haven't seen much go beyond just normal kind of distraction therapy, kind of helping people going on a travel adventure in VR or some history reminiscence. I think VR is very well suited for light exercise, helping with dementia and cognitive decline for seniors. When it comes to from what I've heard from members, in terms of the care facilities, these things usually come out of their activity budget. You'd hate to think of treating cognitive decline as an activity, but that's where the focus is right now. And there's not enough published clinical studies demonstrating the value impact for seniors. It's not that I don't think it's there, but those studies haven't taken place yet. The VA, though, is having very good success with VR with its senior population in a variety of ways. They're now at a point where they're trying to scale up internally and institutionalize VR, but there's some infrastructure challenges there. There's some meta challenges there, and it's slowing it down for them a bit. But the VA is definitely one to keep an eye on. They are doing more with VR than any other healthcare organization, and globally.
As far as eyewear goes in VR, there are some devices that are presently being used and recently being approved that are allowing for general exams for the elders. So the cameras inside the glasses will track their eyes. They will do certain other tests that are available as well. So the reduction in mobility is being addressed using VR, which has been kind of cool. Again, I mentioned earlier, I'm a freak about things being super accurate. So I'm trying to pay as much attention to that as I can, so that when we do jump in, we can make a difference.
I know there was one more question in the back for Hector. Do we want to get to that? Sorry. While we're getting to that too, and Charlie, I know you asked specifically about CNAs and like actual training for CNAs. I think what we're seeing right now is you're seeing slow adoption at the medical education level. A lot of medical education is frankly directed by the American Medical Association. So until they really jump in and say, this is where we're going to do, you're not going to see a lot of it at the med schools. That said, there is a lot of it happening. There's a lot of companies that are putting out technology for training. I've definitely seen some for specifically senior care. I don't know what the rate of adoption will be. It's there. It's just a matter of adoption is slow, and ultimately, as Bob said earlier, until we get a lot of headsets on a lot of people that make decisions, because once they get the headset on, they understand how it works. Very hard to get them in a headset, though.
And also, I think that once that augmented reality is available and comfortable, I think you'll see a lot more adoption. One of the biggest challenges that we've had when I was in my past life was the headsets are too uncomfortable and too heavy, and the frustration or the patience level of most seniors is very short.
All right, I want to see. Tom, can you check that room again? It looks like we might have lost the video on the cameras. Can you guys hear us in the virtual space?
Yeah, we can hear you.
Okay.
It's
We
just
can,
not,
Matt. But it'd be great if you could repeat that question, actually, for us.
The question has not come through yet. It's going to come through right now.
Thank you, everybody. Hector, I have a question. You showed an educational video. I was wondering what your model is, your strategy model is for entry into education. Like, for example, the medical field and the healthcare field are pretty wide. And what is your approach in terms of, Are you tackling universities? Are you tackling healthcare companies? Are you tackling hospitals? What is your entry model approach with the tools that you have, and how successful have you been in penetrating any of those? Thank you.
Yeah. Okay. So that's an excellent question. I can hear my voice and feedback. Sorry. Yeah. So we've been tackling universities first and foremost, and institutions like universities that have healthcare courses in them. We started with general medicine, but then we quickly branched out into nursing. And now we're even tackling pharmacy schools. So it's been very interesting for us, as in we built the tech for general medicine, but we quickly met out with people of the different fields of healthcare, saw the need for them. Pharmacy, for example, is something that we're just starting to work with USC in California, and for us, that was pretty big institution that really enlightened us with a new space for our technology. And I think also to answer that, a lot of people ask us why not hospitals, why not more clinics and hospitals. Usually, from what we've seen, universities have a more straightforward process to accept new deployments, new technologies, and for us as startups, speed is everything. Being agile, having those use cases as fast as we can with the technology that we have. So I think that's mainly the reason why. And right now we have courses, as I mentioned, in general medicine in universities, and in nursing institutions, and now even pharmacy school. So we're very happy about that, and that's our main strategy. And we are trying to replicate that strategy now in different regions. As I mentioned, our first clients were in the US, but also Latin America, including Chile and Peru. Now we're also looking into the Middle East. They have very much a need also for these kind of simulations. And I'm very optimistic about it. You also asked how was the rollout of our deployments, but it went from 0 to 100 really quick. There was probably a year that we were just building the framework, and Bob knows it. He was with us through the many steps of our updates: AI, hand tracking, multiplayer, customization. And now all of a sudden, with the completed product, we launched it to the market, and there was a lot of interest because we really were challenging the way of the simulation was being deployed in XR. We really challenged the notion of what would the features be, what would the universities expect. So I think we found a lot of excitement, and that's how we've, I think, in the past 4 months, closed all of our clients so far. And yeah, we're looking to replicate that same kind of rollout next year.
And Matt, can I want to just offer Bob, did you have a question that you wanted to ask?
Yeah, this was for Hector, and it was kind of after the presentation. But Hector, just it's a little bit tongue in cheek, but I'm also but generally curious. How do you describe to potential customers when and understanding what the difference between a mixed reality application is built on Quest 3 or not, and an AR application? Because I still, again, this is an area that we've debated for many years internally in the industry and trying to define clearly between the two. And mixed reality, again, was a term that was made up, by Microsoft back in 2017 for their VR headsets. But I still get confused in trying to explain it.
So do I, Bob. So to be completely honest, you can even check a timeline inside Simtrix. If you look at the cached pages of Simtrix.com, you will see that we've been toying with, first off, it was spatial computing with Apple. Then it was mixed reality. Then it was just spatial simulations. We've been just toying with the term because the market dictates the term. But to us, we aren't either on the VR spectrum or in the AR spectrum, and I can really plainly explain why. So we are not in the VR because really straightforward, right? We don't use all of the virtual background. We just use the virtual elements, but with your pass-through background, right? So it's not VR, and we don't really want to be associated with VR because we very from day one that was our main differentiating feature, right? But why not VR, AR on the other side? It's because we feel like we do so much more than just point the camera and just let you look at an overlay of a 3D element on the real world. Why? Because when you put the headset on your head, now you have your hands free to really interact as you would do in VR. I think the level of interaction of you touching things, really going with them, almost touching like hand to hand, body to body, being in that same space, that makes it seem more involved than AR. I used to see a lot of AR was just to let's just overlay a static thing and let's not have you interact so much with that. But in our software, it's really the hand tracking with physics. It's what right now is our main differentiating feature, and we're very proud of all the work that we've done with that. So I think to call it AR would sell it short of the involvement that you have with the patient in front of you. So I think we sit really in the middle of that spectrum.
If I can just add on top of that for a second, because I get a lot of flack over the years for, well, why haven't you changed the name of IVRA? It's still called Virtual Reality Association, and I mean, and then there was this period for a couple of years was every company was changing their name to something XR, and their domains and everything, and I've stuck with, and even Microsoft gave us a hard time. Oh, we don't have anything to do. We're just AR with the HoloLens. But I've always considered kind of VR an umbrella term, and I do still think that for good or for bad, the press, the media, and everyday people quickly understand the term virtual reality. As soon as you have to try to explain what extended reality is, it's not a simple one sentence conversation. And I think and AR, I don't know if common people if understand augmented reality. Most people didn't understand that Pokemon Go was an AR application, and it's just it is hard to distinguish and explain the differences between all the variations. But
I agree, and from your point of view, Bob, definitely I think VR works because you're trying in 1 second tell the universities what you are about, which is right, mostly putting a headset in your face. VR is that, putting a headset in your face. It's basically the notion. In our case of Simtrix, we didn't want to go with VR because we want to challenge VR. We want to challenge what people expect. So if we say VR to our end clients, it will be like, oh, you're like the thing I tried 3 years ago, which we are decidedly not. We're decidedly trying to challenge that. So for us, it was really trying to challenge that. But in the case of the VR, I think it really summarizes well because you have just a lot of companies that really do a lot with machines that you put on your head or that you challenge your perception of the world. So I think it works for different cases. Yes.
I've got a quick question for you, Hector. This is Ryan. In a lot of the things that I've been doing with the eyewear and as I've been developing it, one of the things that I found when I'm working with the different universities, we're doing an event at the beginning of the month with UNLV. One of the things that I found was every university seems to be wanting to find something that they can, I don't want to say glom onto, but something that they can attach to that will build strong careers for them. Have you guys thought about going directly to the universities, not necessarily to their medical schools, but to their IT or technology departments to talk about how people will be able to support this, number one, and number two, integrate it into the rest of the university's programs?
Right. Yes, that's a great question. So to us, first and foremost, is having the buy-in from the healthcare part of it. Once we do that, we sometimes have had the talk with IT, see how to better integrate it. It is a challenge sometimes to bypass, the university infrastructure. We even had to tweak our product in some ways to be able to be implemented to there. So far, in our early deployments that we've done, it hasn't been a problem. But yes, IT is definitely involved in the talks, and they've definitely been interested to further expand the implementation. Now, kind of like what I mentioned, as a startup, we are really focused on making the use cases as big as possible and really focused on healthcare first. But we've had already some of our clients, different courses and different careers of their own universities reach out to us to do their different programs and software for courses. And that's something that we're exploring right now. But we've been first and foremost healthcare, and as you mentioned, IT is a big part of it. And we definitely have to talk to them in all of our deployments so far, for sure.
I'll just add really quick to get specifically to your question about universities actually looking at like XR for healthcare as a career track. There's definitely university buy-in at this point to a certain degree at some universities towards XR as a career track. DePaul University, their CDM program has a lot of people doing 3D programming development, not just in gaming, but also for B2B uses. I think we need to see a lot more adoption. I think there's a lot of adoption that goes on behind the scenes, unfortunately, that we don't get to talk about and it's not public, which is unfortunate. But that said, there's a push there. I don't know. Universities are slow. They're very, very slow to change things. But I can say that is actually happening.
You're right, it is. I mean, I was on a very long call today with the university, and that was their main focus, because I believe they don't think that's not going to happen. I know, one of their big questions was, those people who are interested in the technology, how are we going to support this once it takes off? Not if it takes off, but once this takes off.
I will say something about the universities because I've worked at many and also had a lot of conversations with leaders in universities, and that is that they are much like the hospitality industry in that they want to see the dollars result from the stuff that they can sell, and it is a challenge. It just is a challenge with universities, and I think that hinders decision making because it oftentimes is what is the bottom line.
All right. So what we're going to do at this point, because we're wrapping up towards the end here, is we are going to I'm going to let all of our presenters start to think about what they want their final statement to be, and I'm going to do some house cleaning while we get to that. So the way this is going to work is there's going to be, each panelist will have about 30 seconds to give a closing statement. That closing statement can be whatever you want, but try to keep it to about 30 seconds to a minute. That's the main thing I'll say about that. I will call on you in a random order. After that, Caroline will give some closing remarks. I'll give some closing remarks. We'll do some final housekeeping. But with that, I think I've spoken enough at this point. And so I think up first, we're going to go with Hector.
Perfect. Thanks a lot. Well, thanks everyone for being here and letting me share a bit about what we're working. I think my closing statement would be that, I am very optimistic about XR, and I think that the current technology of XR is good enough for long-term deployments and in big scale. That's what I'm seeing, but it also required me and our team at Simtrix to really challenge the design. It requires a big challenge in doing, again, the design of everything. But if you can manage it, I think that there hasn't been a better time for the technology right now for the mass scale adoption. The context is hard. Right now, definitely the universities don't have as big a budget as they had, kind of like what Bob mentioned a little bit. But the rest of the world, or even the US, there are some universities who have the budget. They will bet on this kind of technology because I do think it's ready. So call me an optimist, but I think the best is still ahead of us, and I'm ready to see that future.
Excellent. Bob.
I guess I'll echo what Hector said. I mean I'm optimistic. I wouldn't be working in the healthcare VR space for 10 years and continuing to do so if I didn't believe in the value that the technology can bring to people. I am frustrated with the adoption, and it's a lot of reasons and complicated issues behind it. I wish Meta would get its business act together and provide a simple solution. I think they would be the hardware vendor of choice for the long term if they just simplified the device management requirements and other issues. And I want to see a university or two, have their freshmen come on with a headset. And don't worry about what the curriculum is. I want to see what students will do with it after 4 years, because we have to build that ecosystem with the hardware. And it's frustrating when I've got 5 seniors in my class, and none of them have really had any experience with VR, and this is their first taste with it.
Okay. Go ahead, Ryan.
Thank you, everybody, for letting me sit here and chat and share. I do think that this is something that when you think of eyes and you think of hardware, I'd love for you to think about us. We are not the fastest to create, but we are very focused on details. The healthcare space, your eyes are in the healthcare space, and that is my passion, and that is the passion of what we do. So, again, thank you guys.
All right, thank you, Ryan. For our presenters, thanks, you guys. You can turn off cameras. You can mute yourselves. Step down. I'm going to let Caroline, I'll let the applause go. And go ahead, Caroline.
So I'm going to just share just briefly a little something different. I just spent today, used Google's Notebook LM with a series of medical notes and visits from the last 5 months from my aunt, who's had so many issues with the healthcare system. And a lot of it was boiled down to coordination of care. And it created 2 podcasts, which were each like 10 minutes each. And it was so exciting to me to produce this in about, I don't know, I spent probably about a half hour putting the data there, stored locally, just like it would be for a G drive. I am really excited about the potential for that kind of technology to then be able to integrate with healthcare education and healthcare clinical settings. And there are so many incredible founders out there already doing incredible things. I do get a little bit frustrated, like everyone does. So I think we have a weird time machine that we're in at the moment. But I think ultimately my timeline might be a little later than Hector and Bob, but I think it's not going to be left behind. There's just too many potential upsides to this that are already being used. So I'm optimistic, but I am really excited about the potential of blending those 2 kinds of technologies together for a powerhouse. That's my feeling. Thanks.
All right, thank you, Caroline. I mean, the last thing I'll add on this topic, there's a lot of recurring themes that we hear about. Everybody across a lot of industries, people who work in XR are generally frustrated with the rate of adoption. The more I'm thinking about this, the more I'm hearing about it. Quickly. Why do I think that is? I'm getting to that right now. I think a lot of the adoption issues have been, Bob alluded to it. I think the major companies that are producing XR hardware have done nothing to help themselves with keeping adoption. They change the tech very quickly. They change the way that they roll it out. They change the way that you're allowed to manage it. And there's a lot of problems specifically with incorporating this technology into an enterprise setting. Most of the devices are consumer-based. They're not really made to work in an enterprise setting. And I will say that the enterprise is what's going to ultimately drive adoption of this tech. It's when you have to use it for work because it makes you more efficient at work. That's going to cause people to use it more. That's going to cause more people to then take it home and adopt it there as well. That's my opinion. It's the same opinion I've had for about 7 years, so it hasn't changed much. And I think until we do actually have headsets and software and everyone that is focusing on things like compliance and SOC 2 and privacy, and not just how do we make this really cool for every individual to have one, you're not going to see the adoption actually accelerate. But that said, healthcare itself, and when we talk about healthcare, the power of the technology, like this is a Pandora's box. The cat is out of the bag. It's not going away. People realize how powerful this tech is for learning and, giving, again, practicing surgery. You get a safe space to fail, which there is no other technology right now that allows anybody who's training to be a surgeon a safe place to fail. Even the dummies, if you're training on the surgical dummies, that's thousands and thousands of dollars for you to practice a failure case once, where you could do it in a headset 1,000 times. So it's not cost effective to use other technologies. This stuff is going to come around. It's going to get adopted. It's going to take time. Universities are slow. The healthcare system is slow. And frankly, we kind of want them to be for a certain degree. We don't want risky stuff getting out there. But I will say, I'm hopeful that it's gonna be moving a little bit faster. I think at this point, I don't know if there's any real U.S. companies besides Meta that are producing headsets. Obviously, they've got some competition in Pico and HTC, and I think the fact that Pico is taking a lot more market share in the United States right now for business use cases is a good thing, because I think it's sort of showing the path of what has to happen. But with that said, I'm hopeful that this technology is going to adopt. I really think that we've done healthcare as a topic for several years now. What's really neat is that you just see the different ways that the technology, like new technologies like AI being integrated into it, like hand tracking being integrated into it. This stuff is happening instantly. All right, housekeeping stuff real quick. So our next couple of events, October we are going to do collaboration and the workspace. That is a hybrid of the event that we were going to do in August. We're going to be talking about social collaboration spaces as well as how XR technology is being used in the workplace. November, we're going to talk about new technology, and December, we're going to talk about training. That's not October over there. But that said, these are our social tags. Hopefully, you guys will follow us. We'll share our stuff out there. We do want to raise, one of the reasons that we keep asking for money is because we want to actually do more promotion of this, and frankly, we want to have more people on the live event staff who can actually do things like run the soundboard and do some of the troubleshooting so that we don't have technical issues. But with that said, for those of you in the physical space, there's still drinks, there's still food, there are some live demos. I know Patrick is setting up a demo in the back of the Simtrix. So if you want to see Hector's technology, talk to Patrick back there. I know Ryan up here is going to have some demonstrations and some QR codes to pass out if you want to try his technology. But with that said, I will say thank you one more time to all of our presenters for joining us this evening. If I can get another round of applause for them, thanks. And I'm going to throw the QR code up for donations because I always leave that slide up at the end. And we hope to see you next month. And if you have any questions, feel free to talk to myself or Tom, or we'll be here networking. And I will thank those of you in the virtual. Wow, I see fireworks going off in the virtual space. I don't even know how you do that. I see hearts and fireworks. There's all sorts of weird stuff going on over there. All right, but thanks for joining us, Bob and Hector and Caroline. Thanks again for hosting. We will see you all soon. And Tom, thanks again for I'll just say punting because it's pretty much what you're doing the entire night. Just punting for new problems as they come up. We will, and Ron, and with Patrick. There they are. We'll hopefully see you guys next month. Thanks all.
Thanks, everybody. That was great.
Caroline, give me a second. I'm going to mute you in the room here. Thanks, you guys. I'll speak in once you're muted one more time. Okay, you're muted. Good to go.